Hi everyone, here's my little screencast about my research paper that I did on the integration of mobile technology in nursing clinical education. First off, my name is Anna Cable, and this screencast was prepared for EDU5188, the integration of technology in education for the University of Ottawa. So, what propelled my interest in this topic was the tremendous change that I've seen in the clinical setting since I became a nurse over a decade ago. When I started there, signs were posted around the hospital warning people not to use their cell phones for fear that cell phones would interfere with their life-saving equipment. In 2006, we used pagers to reach members of the interprofessional healthcare team, and our common way to send documents was through fax. Fast forward to today, and I'd be lost without my smartphone. It holds not only access to my patient's electronic health record, but also drug libraries and nursing and medical references. Truth be told, pagers and fax still exist, but more often than not, nurses will sidestep them in favor of using texting or messaging to get in contact with members of the healthcare team. So, it would seem from my reading that my experience is not unique. According to a survey done by Flynn and other authors in 2018, 85% of nurses use their smartphone for work-related purposes. The most common uses of mobile phones in the clinical setting include many of the uses that I mentioned earlier. This omnipresence of smartphones in my clinical practice is in direct contrast to how nursing students come to the unit for their clinical placements. Students often assume that their smartphones will have to be turned off based on previous clinical experience. Students and clinical instructor colleagues tell me that often students are asked to leave smartphones in their lockers during clinical placement. Students also arrive with bags full of textbooks and a calculator, whereas I have not personally opened a physical textbook in many years in my practice, and my calculator has long been relegated to my locker as a just in case my phone battery dies. Students also come with no knowledge of the apps and tools available to them through both their university fees and the hospital setting. Through their university and the affiliated hospital system, students have online access to drug libraries and medical dictionaries, but often no one has facilitated their access to them. So, how can mobile technology fit into clinical nursing education? In recent years, there has been a nursing shortage throughout Canada. This means that nursing schools are increasing enrollment and often have to divide precious clinical placements between more and more students. This leads to an individual reduction in clinical hours for students. Mobile technology fits in well here by streamlining access to resources at the point of care and also can facilitate peer, instructor, and healthcare team communication, freeing up precious clinical time to gain the most from their limited time. So, some of the student nurse benefits of using their mobile phone within the clinical setting would be that they have instant access to evidence-based data, which in turn can aid learner confidence in the setting. Students can also use their mobile phone as a communication device between themselves and their peers, their instructor, and other healthcare professionals. Some studies also showed that the in-the-moment nature of a smartphone made it a great tool for reflective journaling. So, why aren't we utilizing these powerful tools in student nurses' pockets? In my research, some of the barriers that I found to mobile phone use in the clinical setting were concerns about privacy and confidentiality. This was especially true for bring your own device, where there is rightly so fears around theft, loss, and use of identifying data in unencrypted apps. Students were also worried about the perception of their patients and family members, as well as the perception of other staff and instructors when using their phones. Students in one study felt afraid to compromise their professional image by having people think they were doing non-work related things on their phones. Tying into this was the generational gap between students who are often digital natives and their instructors who have had mobile technology incorporated into their practice. Students also took into consideration the age and comfort of their patients. For example, they felt it might be less appropriate to use a smartphone in front of an elderly patient. Other barriers to student use of mobile technology in the clinical setting are the possibility that mobile phones could transmit infections and other device limitations, such as the high cost of devices, limited battery life, and problems to connect student devices to wireless networks. So what does the future hold for the integration of mobile devices in the clinical setting for nursing students? Well, overall, I think the sky's the limit. If you think about how far we've come in nursing in the last decade, I think it becomes obvious that hospitals and schools of nursing need to think about how to incorporate these powerful tools into the clinical practice of students. One of the first themes revealed in my research was a need for schools of nursing to be very explicit in terms of what's allowed and not for students. Guidelines should be developed and published that relate to what kind of device, what can be entered and stored on a device, and how to properly disinfect personal devices. These guidelines need to be in line with Canadian law for health professionals on the safeguarding of patient personal health information. Additionally, in order to encourage role modeling by faculty and educator, there needs to be training for instructors on how best to guide students to use their mobile devices. Multiple studies that I read talked about the importance of role modeling for student nurses and new nurses. Finally, there needs to be technical support available to help students and faculty overcome the obstacles they will inevitably face when accessing, installing, and connecting to apps on their mobile devices. So that's my little write-up about my research project. If you have any questions, then you can find me at the email address listed below. Thank you very much for listening.